Welcome to this lecture on Sertraline, an essential medication in psychiatric practice. This session will cover its mechanism of action, indications, dosage, side effects, contraindications, and special considerations. Sertraline is a selective serotonin reuptake inhibitor, or SSRI, primarily used in depression, anxiety disorders, OCD, PTSD, and panic disorder. It is one of the most prescribed antidepressants worldwide due to its efficacy and safety profile. Mechanism of action. Sertraline works by blocking the reuptake of serotonin in the synaptic cleft, leading to increased serotonin levels. This enhances mood regulation and reduces anxiety. Unlike some other SSRIs, sertraline has minimal effects on norepinephrine and dopamine, making it a well-tolerated option for many patients. Pharmacokinetics. Absorption. Oral bioavailability is around 44% due to first-pass metabolism. Half-life, 26 hours, allowing for once-daily dosing. Metabolism, primarily hepatic, involving CYP2C19, CYP2D6, and CYP3A4 enzymes. Excretion, mostly in feces, with minor renal elimination. Indications. Sertraline is approved for several psychiatric conditions. 1. Major depressive disorder, MDD. First-line treatment. 2. Generalized anxiety disorder, GAD. 3. Obsessive-compulsive disorder, OCD. FDA approved for adults and children. 4. Post-traumatic stress disorder, PTSD. Helps in symptom stabilization. 5. Panic disorder. Reduces frequency and severity of panic attacks. 6. Premenstrual dysphoric disorder, PMDD. Manages severe premenstrual symptoms. Dosage and administration. Sertraline should be started at a low dose and titrated gradually to minimize side effects. Starting dose: depression and anxiety, 25 to 50 mg once daily. OCD, start at 50 mg, increase gradually up to 200 mg if needed. PTSD and panic disorder, start at 25 mg and titrate up. Maximum dose, 200 mg per day. Onset of action: partial response in 1 to 2 weeks, full effect in 4 to 6 weeks. Tapering is required when discontinuing to avoid withdrawal symptoms. Side effects. Common side effects include gastrointestinal symptoms, nausea, diarrhea, sleep disturbances, insomnia or excessive drowsiness, increased sweating, sexual dysfunction, which is a major cause of non-compliance. Serious side effects to watch for: serotonin syndrome, a life-threatening condition with symptoms like hypothermia, hyperreflexia, and autonomic instability. Risk increases when combined with other serotonergic drugs, such as MAOIs, linezolid, or tramadol. QT prolongation, rare, but caution is advised in patients with cardiac conditions. Hyponatremia due to SIADH. More common in elderly patients. Increased bleeding risk, if combined with NSAIDs, aspirin, or anticoagulants. Discontinuation syndrome. Abrupt withdrawal can cause dizziness, irritability, flu-like symptoms, and mood disturbances. Solution: taper the dose gradually over several weeks. Contraindications and drug interactions. Contraindications include hypersensitivity to sertraline, concurrent MAOI use due to the risk of serotonin syndrome, severe hepatic impairment, as metabolism is primarily hepatic. Key drug interactions: MAOIs, tramadol, linezolid, risk of serotonin syndrome, warfarin, NSAIDs, aspirin, increased bleeding risk, carbamazepine, phenytoin. Can alter sertraline metabolism. Caution is also required when combining sertraline with benzodiazepines, as excessive sedation may occur. Special populations. Sertraline requires dose adjustments and careful monitoring in special patient groups. Pregnancy and lactation, classified as Category C, meaning there is a potential risk to the fetus. Some studies suggest SSRIs may be linked to neonatal withdrawal syndrome, but Sertraline is still one of the safer options during pregnancy. In breastfeeding, small amounts appear in breast milk, but adverse effects are rare. Pediatrics. Approved for OCD in children aged 6 and above. Monitor adolescents for suicidal ideation, as SSRIs may increase suicide risk in young patients. Elderly. Increased risk of hyponatremia and falls. Start at lower doses and monitor sodium levels regularly. Conclusion. To summarize, Sertraline is a first-line SSRI for depression, anxiety, OCD, PTSD, and panic disorder. It works by increasing serotonin levels in the brain, improving mood and emotional stability. Common side effects include nausea, insomnia, sweating, and sexual dysfunction. Serious risks include serotonin syndrome, QT prolongation, and hyponatremia. Tapering is essential when stopping the medication to avoid withdrawal effects. Special considerations apply to pregnant women, the elderly, and pediatric patients. The key take-home message: start low, go slow, and monitor closely. That concludes today's lecture. Thank you for listening.